Oncoplasty is literally the fusion of onco, which is cancer, so cancer surgery, as in surgical oncology, and then plasty, as in the plastics, aesthetics, cosmetics. And like you said, it's kind of a hybrid of plastic surgery and cancer surgery. And what was happening is breast surgeons, when we were initially taught, and I can speak to that because I was taught in that kind of training, which was, you're just saving lives. Who cares what it looks like? Let the plastic surgeons deal with that. And in Europe, they were doing this oncoplasty for many years before it came over to the US. And it was really the ideology of you can take out cancer with oncologic cancer principles, making sure you got a negative margin, making sure you've gotten all the way around the cancer and gotten it all. But at the same time, if you know what your target is and you preoperatively map or plan the patient's surgery with the reconstructions, then you can create a surgery that is less deforming. And in some cases now, the oncoplastic techniques are so wonderful that the patients have a better or improved cosmetic outcome. We can take the cancer out in the form of a reduction. Well, they had all this extra redundant tissue, and we need to take volume out for the cancer. Well, let's just take it out in a reduction pattern. It's a win for the patient, it's a win for the cancer. We get larger negative margins, which is always good. And in 20, 30 years, when they're getting older, they don't have the neck or the back pain. So there's a lot of reasons why having a pre-game plan is helpful. And what we want to do is change women from worrying about being deformed to just being about cancer-free. And when I train, I often say, when a patient tells you they don't care what it looks like, let me tell you, they care what it looks like. And especially when they're in that kind of stress, fight or flight, I have to get it out, I have to get it out, please. 2 years later, they're like, oh, you know what? I wish you'd made the nipple a little smaller, or I noticed this or that. It's amazing the transformation once they're cancer-free and they're through that hoop, that the cosmesis is very important. And then there are people who will say, well, she's 80. Well, cosmetic outcome is something that's important to a woman. We are raised in a society where image is everything. And the other thing is it's a scarring reminder that they had cancer. So when they see a deformity, it brings back that fear, the trauma they've been through. So if we can optimize the treatment, if we can optimize the evaluations with genetic testing of the tumor in the patient, why can't we optimize the cosmetics? And that's what the American Society of Breast Surgery is doing by doing all of these courses for training breast surgeons to be able to say, well, I don't need to get a plastic surgeon in here, but I am going to rotate a little lip of tissue into the deficit so it doesn't look like we were here at all. If we're cutting someone, we can't avoid it. We're going to put a scar on the breast, but now we do scars around the edge of the nipple, underneath the breast, in the armpit. It's basically called a hidden scar technique, where we can try to make it as aesthetically pleasing as possible so that patients aren't with that constant reminder.